Hello and welcome to Veteran SITREP on WHFC. I'm Colonel Bill Montgomery, a combat veteran who retired after 30 years of Army service. We created this program as a unique outreach to better connect with veterans throughout the community. Additionally, we wanted to ensure we shared important resources in every program centered around a particular topic or concern. Our goal is to equip veterans, their families, caregivers, and the supported community with as much solid information as possible. Today, we feature the first of what will be many interviews in partnership with the VA Maryland healthcare system. If you're interested in the fine details about the PACT Act, this may help you out. Welcome to this episode of Veteran SITREP. We have Dr. Vishal Vaghela, Deputy Chief of Staff of Healthcare and Business Operations at the VA Maryland Healthcare System. And with him, we have Antoine Waller, the Executive Director of the Baltimore Regional Office for the Veterans Benefits Administration. Thanks so much for both of you to come by the Veteran SITREP studio here at Hartford Community College, and thanks for taking your time.
Thanks for having us.
Yeah, thanks for having us.
Well, I always like to start off our conversation with connections to the military. And if you wouldn't mind, both of you, kind of sharing your personal connection to the military, because I often think that connection probably fuels what you're doing today and probably certainly has an influence on the folks that you actually see. So, Antoine, I'll let you start off.
All right, thank you. And again, glad to be here with you. My personal story is I entered active duty back in the 1980s, served nearly 5 years in the field artillery. I'm local to the state here in Maryland, and after transitioning out of the military, I needed to continue to serve, and I happened to really stumble upon VA, but once the door was open, I've not looked back for the last 32 years, so I've really enjoyed my service to veterans and their families.
Wow, 32 years.
Yes.
So right after the military, I like your word stumbled. You stumbled into the VA, and you're still standing, right?
It was not a perfect transition, but it ultimately led me to the VA, which I have always appreciated and been very honored to be a part of the great mission.
That's a cool connection. Yeah. Dr. Vaghela?
Well, thanks for asking. I have to say I love this country, and I love the freedoms that this country offers. And it has been one of my life's goals to serve those that have served others. And I found that through a career at the VA. I've spent my entire medical career at the VA, and I'm able to every day provide world-class health care to those who have sacrificed so much for our freedoms. And it's just one of the greatest joys that it brings me. I love going into work every single day.
Wow, that is so cool how both of you have done nothing but this your whole professional career. I said at the top of our show what your positions were and where you were located. Can you share with the audience a little about what your position is and how you serve veterans through that office? Antoine?
Okay. Thank you very much for the question. I'm the Executive Director of the Baltimore Regional Office, responsible for all the non-medical benefit delivery for veterans and their families. For example, if a veteran is injured while active duty, they can certainly file a claim with our office, and we'll be responsible for processing that claim until a decision is made. But we also offer other benefits that are non-medical, home loan program. We also have life insurance, education benefits as well.
Well, thanks for sharing. I get confused sometimes with what the Veteran Benefits Administration does, and it's helpful to kind of have that explanation for our audience. Dr. Vaghela?
Sure. So I work for the VA Maryland healthcare system. Of course, that's part of the VHA, which is the Veterans Health Administration, and we are responsible for providing direct veteran-centered patient care. So our office actually provides medical care to all of our veterans. So not only providing direct patient care, but we also provide care to our veterans through education and research that's going on within our departments as well.
Thanks for that explanation as
Yeah.
well. So is there a relationship, I'm assuming there is, you two are both here with us, between the VA Maryland healthcare system and the Veterans Benefits Administration?
Oh,
Could you all
absolutely.
share?
We're like partners in crime.
Oh my gosh.
So the veterans will enroll with the VA. So they come. They're either already enrolled, or you can enroll here at the VA. Anytime you need a veteran's benefit, right, or you need to file a claim, we're going to deal with the medical part of it. We're going to handle the health care, and then we're going to hand it over to our friends over at the VBA.
And that is a relationship has really worked well. We often are in the same venues together, make sure that we're sharing information that is beneficial to veterans and their families. So the relationship has really been outstanding.
Wow. I didn't know those two were actually broken up in that way. Now, what if a veteran isn't sure what their concern is and which way they have to go? Do you have a recommendation on, should they go to the VA healthcare system first, or should they go to the Veteran Benefits Administration?
I would recommend that any veteran that has any question, they can certainly call our national call center.
Okay.
That's very simple. It's 1-800-827-1000. And from there, they can ask whatever question they have on their mind.
Okay.
And they'll be directed of the best outcome and place to go.
Good.
They can also come into our local regional office and see our representatives there to ask the same questions, and we'll provide an appropriate response and service for them.
So you're able to basically listen to what they have on their mind, and if there is a medical piece, get them in the right place.
Yeah,
When
we kind of prioritize to make sure that we're listening first
Yeah.
and not assuming that we know exactly why they're here. So if we can really support them by addressing each of their concerns, we'll do that and have them continue to be served in the right way.
That's a great service. Well, as you both know, and I learned earlier, probably this year or late last year, Congress recently passed the Honoring Our Promise to Address Compensative Toxics Act. I never knew what the PACT meant until I actually looked it up and spelled it out. So that certainly is in many veterans' minds right now. But I don't want to assume that anybody listening either understands what the PACT Act is. Can both of you kind of help us understand what is that act? And probably more importantly, what should veterans know when it comes to what they should be doing?
Yeah, let me go ahead and start off with that. So President Biden signed into law the PACT Act on August the 10th of 2022. And the PACT Act is the promise to address comprehensive Toxics Act. And that is the most comprehensive health care and benefit package that's ever been shared with our veterans. And it also allows our veterans that are exposed to burn pits and other toxins to be served. And it covers a generational of veterans that have served our country.
Did you want to add anything, Dr. Vergeer?
Yeah, I agree with Mr. Waller. It's one of the biggest expansions of veterans benefits that we've ever seen, probably since World War II. It provides any veteran that's enrolled in VA healthcare the opportunity to be screened for toxic exposures. And it also has given the VA, the VHA, resources to focus on research, staff education, and treatment related to those toxic exposures.
Wow. And this sounds like an act that could go into both areas, hence probably why you both are here. Huh?
Mm-hmm.
Who have you found is impacted by the PACT Act? And probably more importantly, who can apply for those benefits?
So I'll go ahead and start that. The PACT Act allows eligible veterans that have served either in a Vietnam era or Gulf War era or post-9 era of service, and has a condition that is exposed to any of our 20 new presumptive conditions like asthma or chronic bronchitis, rhinitis, or sinusitis to apply for benefits. And there we'll continue to serve them by processing their claims as well.
Now, when you say the word, is it presumptive?
Yes.
What does that mean to our audience when they hear that? Because it sounds like you said 20 conditions that are presumptive. What does that really mean in layman's terms for those that are listening?
There has been a change in years past. There was a sort of a conception that a veteran had to prove that their service was actually the cause of their current diagnosed condition. But because of the PACT Act and because of establishing the 20 new presumptive conditions, they no longer have to prove that their military service was connected to the diagnosed condition that they currently have. All they have to show is that they have a diagnosed condition of one of the new presumptive conditions and that they have qualifying service during a period of time that is either during that Vietnam era, the Gulf era, or the post 9/11 era.
And I would assume that move saves the veteran a lot of time when it comes to processing of their claim.
It does. From there, they'll proceed to have a medical exam to make sure that the condition is still valid, and that will continue to follow the process of their claim until a decision is made.
I understand that all veterans are eligible for a toxic exposure screening. But what does that entail, and how do veterans go about getting screened?
Yeah, absolutely. Thanks for asking the question. So I can tell you, I'd like to share with you that the VA Maryland healthcare system has already screened over 33,000 veterans.
Wow.
Out of those 33,000 screenings, we've actually had a positive screen, what we call, for about 13,000 of those veterans. And so there's a couple ways veterans can get screened. So one is any VA provider, whenever you come in to get care, has the ability to screen a veteran for toxic exposures. Many times this is done in the outpatient setting. You're either seeing your cardiologist or your primary care doctor. All of us are trained to ask questions about toxic exposures. And these questions are simple. Do you know of any toxic exposures? Have you been exposed to Agent Orange? Have you been exposed to radiation? Have you been exposed to burn pits? Do you have connections to Camp Lejeune? So these are simple screening questions. We also have an outreach program through our occupational health department where we will outreach to veterans and also ask them the same questions to do their screening. If a veteran does screen positive, then we will, that's kind of like passing it over, right? We're going to provide the veteran first and foremost with the medical care. Make sure that their medical issues are being addressed. If they have any of these presumptive diagnoses that Mr. Waller spoke about, which are usually lung related, especially if they're cancer related, we're going to make sure that we're addressing those medical issues first. Once those medical issues are addressed, we're going to give them the information. We have some local contacts and also at the VBA that's going to help them file that claim.
Wow. So we're into a little more than a year since the law has been enacted. How many veterans and their spouses have applied for benefits to date? And I'm assuming that might be a different number than you just talked about, Dr. Vigela. Can you share with us how many have actually applied? And I didn't know their spouses could apply too.
Absolutely. So since the law has been enacted, we've delivered more benefits faster, serving more veterans and their families than ever. Just to put a number to that, since the implementation of the law, we have close to 1 million veterans have been impacted and have claims filed with us. We have completed almost half of that, 500,000 claims, and we've seen a very high success of claims that have been completed and approved, putting money's benefits into the hands of families and veterans as well.
Wow, that's a lot higher number than I thought. And I guess that's good. You want to be able to see that kind of a response.
And we know that there's millions of more veterans and families that need to certainly know about the PACT Act in order for them to file for these benefits as well. And we're campaigning through outreach in order to have that great success.
And we're glad you're here as a part of this program, because our whole goal is to hopefully get that word out through a conversation. And it's great that we have both of you here to kind of fill in those blanks and probably more importantly, let veterans know how you all partner to kind of help them and their families. So talking about outreach, we know that VA is doing a lot on the outreach side to kind of raise the awareness that some have great outcomes with the efforts of your own teams locally. Could you share with some of us some of those outcomes when it comes to the success that you've had with them?
I'll share a story that was provided to me, and I know the outreach events that we've been on. We've partnered with our healthcare partners in Maryland to do claims clinics, and when we have these opportunities and veterans will file claims, this particular good news story is that a Navy veteran had previously filed for a claim during the PACT Act, and it was denied. And through the new legislation, we were able to then go back and review that claim and determine that because of the known conditions, we were able to then approve that claim. And it created a retroactive benefit favoring the veteran, and they were given over $50,000 in a retroactive benefit. So that's one of the many stories that we continue to hear about the success of the PACT Act.
Wow. And I'm sure that veteran was very happy about that. So that was a reevaluation?
Absolutely.
From your office that
Absolutely.
basically had that happen. Well, that's great.
You know what? I would actually like to share one more story. This is a story of about one of our previously homeless veterans. So we have one of our veterans who served in the military from 67 to 68. When the veteran came out of the military, had a bladder condition, filed for a claim in 89. Claim was denied in 91. Well, after the PACT Act, the veteran refiled the claim and was compensated back to the original claim in 89 over $900,000.
Wow.
And this was one of our homeless veterans who now has the means to take care of themselves. And I love sharing that story because although not all examples may be that extreme, it goes to show, even if you've applied before, reapply.
Wow. That's a great story. How does the Act expand and extend eligibility for VA health care for veterans with toxic exposure and veterans from other areas?
So the PACT Act extends benefits to those with the presumptive diagnosis that Mr. Waller had mentioned. Again, many of these are lung-related, cancer-related diagnoses. So it allows the veterans who are already enrolled to get covered and get treated for that care if they're not already getting treated for it. But it also expands the eligibility to veterans who may not have been eligible for VA health care or may not have been eligible for benefits before. So it greatly opens up the door for many of our veterans who may not have been eligible for VA health care before to enroll into VA health care.
Wow. That expansion's important, especially if you don't have any benefits at the moment.
Oh, absolutely. And again, this is one of the largest, this act is one of the largest expansion of services to our veterans that at least I've seen in my lifetime.
Now, to expand on what you just said, will the Act contribute to expanded services and additional medical facilities for Maryland's veterans as well?
Absolutely.
Okay.
So with the PACT Act, right, we're seeing an influx of veterans, but we're also seeing an influx of some of these diagnoses, and we need the tools and the resources to treat our veterans. So the PACT Act actually opens up funding for education. It opens up funding for research. The VA is able to recruit the best of the best because that's what our veterans deserve. We're able to retain those high-quality providers that are going to give our veterans the best care that they deserve. So again, it opens up a large number of benefits, not only to our veterans, but also to our VAMCs, our VA medical centers, to provide the education, to recruit, and to study further other exposures and current exposures and what other diagnoses may come about.
Wow, that's a fantastic expansion. And it sounds like it helps out the whole veteran community because of this one act.
If I could also add, a surviving family member of a veteran who may have been able to receive this benefit may also be eligible to receive compensation as well. That's called the dependency and indemnity compensation. It's a monthly payout if we can determine that the cause of the veteran's death was service-connected to one of those presumptives. They would also be eligible for compensation as a family member.
Wow, so those spouses listening in certainly should I guess as a minimum, if they're uncertain, call your office.
Always.
So they can at least
Absolutely.
explain their situation, and they may benefit from what you
Yes.
just talked about.
Yes.
So how can veterans and their families get more information to kind of start this application process?
So step one, enroll in VA healthcare.
Okay.
So give us a call in VA healthcare. If you want to enroll in VA healthcare, go to www.va.gov. You can also call 877-222-VETS or 877-222-8387. And of course, finally, you can always come and see us in person at 10 North Green Street at the VA Maryland Healthcare System. That's our main campus. And our enrollment center is right there in the front lobby.
Oh, wow. That's convenient.
And if you have any additional questions about the benefits, you can visit the website at va.gov/PACT, as well as call in the 1-800 number, My VA 411.
Now, are there any resources or things that we may not have talked about during our session and discussion that you may want to share and let the audience know about?
You know, I think we had a pretty good discussion, and
Okay.
we've really talked about all the resources. And again, I would just like to emphasize again that step one is enrolling in VA healthcare. And so please come and see us. Please enroll in VA healthcare. Go to our website. You can call 877-222-VETS or see us in Baltimore in person.
And I would also add that even if you are currently being service connected for a condition, but you also feel that maybe that condition has worsened over time, it is another reason to come see us, file a claim, because you can get compensated for any increase in that disability that you may have experienced.
Well, Antoine and Dr. Vagela, thanks so much for taking time to come here and share on Veterans SITREP. This act is so confusing, I think, because it's relatively new.
Mm-hmm.
And I think for many veterans, they don't think it applies to them. But thanks for sharing not only the background on the act, but more importantly, how does the health care system actually partner with the Veteran Benefits Administration? And more importantly, giving the resources that they can begin that conversation. So thanks so much for coming.
Thanks for having
Yeah,
us, and thanks for
thanks.
giving us the opportunity to speak about it.
Thank you very much.
Many thanks to Executive Director Waller and Dr. Vagela for sharing their time and thoughts. If you didn't get a chance to jot down the resources they mentioned, you can find them on our website, whfc911.org. Each week, we'll share a health tip for veterans, brought to you by veteran and fellow WHFC volunteer, Dr. Frank.
With age comes wisdom, but painful joints can occur too. This is especially true for military veterans. Physical training and the rigors of military duties over time can damage joints. Military veterans, compared to non-veterans, are particularly at increased risk for painful knees. Getting into and out of a vehicle, climbing or going downstairs, and even spinning around the dance floor can be difficult. These discomforts are not just annoying, but can potentially lead to other injuries like unintended falls. Hello, I'm Dr. Frank Sparandero, a retired U.S. Air Force flight surgeon, and I want to talk with you about how you can deal with those painful knees. Problems with muscles and joints among military veterans can occur up to 3 times more frequently than for non-veterans. Knee joints are especially prone to repetitive trauma and potential injury to internal structures. As a hinge joint, the knee moves forward and back and absorbs all the weight of the body when standing, walking, or running. There is a cushion, the 2-part meniscus made of cartilage, that is designed to absorb the force of impact in the knee. Over time, and with repetitive downward forces of walking, running, and carrying heavy loads, this cartilage can break down or degenerate, causing osteoarthritis, or OA. This can lead to pain with weight bearing and a possible locking sensation in the joint with movement. OA can also develop after an acute injury and is more common among military members. The knee is supported by structures called ligaments made of dense and very strong fibrous tissue. These too can break down over time or be damaged by acute injury and lead to instability of the knee. There are 2 ligaments that stabilize the knee side to side, called the MCL and LCL, and 2 ligaments that control forward and back movements, the ACL and PCL. Damage to any of these ligaments can cause pain, but also instability or buckling of the joint. It is important to work with your doctor to correctly diagnose specific knee conditions. In this way, appropriate treatments can be recommended. In addition to a comprehensive physical exam, imaging studies of the affected knee may be needed. Physical therapy is the hallmark of treatment, reducing pain levels and strengthening knee muscles like the quads on the front of the thighs. Medications can help to alleviate pain, but your doctor and orthopedist or rheumatologist should recommend what might work best for you. Reducing body weight can help too, as this will decrease the constant force applied to the knees. Modifying your physical environment, like adding grab bars in the bathroom or switching to higher seat entry motor vehicles, should be considered. Switching from high-impact activities like basketball or running to lower-impact sports like cycling can make a difference. Ultimately, knee joint replacement may be needed to restore your ability to be active without pain and physical limitation. Your knees bear all the weight, so it makes sense to do everything you can to make your daily life more enjoyable. Thank you for serving our nation, and please take good care of yourself. For more information on knee problems and osteoarthritis, please visit the website for the Arthritis Foundation at arthritis.org. Thank you.
Thank you, Dr. Frank. A heads up for your calendars. The Harford County Veterans Commission is holding their annual Veterans Family Resource Fair on Saturday, October 21st from 10 a.m. to 1 p.m. in the Bel Air Armory at 37 North Main Street. Mark your calendars, as there will be many services to help veterans, spouses, and caregivers at this fair. Before we go, here's a perk for veterans in Harford County and beyond. Advance Auto Parts offers 10% off regularly priced items for in-store purchases and online purchases by calling 877-ADVANCE, ADVANCE, prior to the purchase. To customers who are currently active duty, reserved, and retired with 20 years or more of service. The discount also applies to veterans with a service-connected VA rating and immediate family members. Veteran SITREP is a production of 91.1 FM WHFC, Harford Community College Radio. Our executive producer is Terry Troyer. Paul Chufo and I produce the program. Matt Terry handles our sponsorships, and Renee Scuddy is our editor. We appreciate the help and input of our panel, including Barbara Travers, Karis Rempel, Bob Brown, Warlene Bryant, and Sharon Jacobs. Many thanks as well to Rosalia Scalia and Ming Vincente at the VA Maryland Healthcare System. Special thanks to our sponsors, Real Life Prosthetics of Maryland and Delaware, and the Association of the United States Army. Again, more resources and information can be found at WHFC911.org. Thanks so much for listening.